This video is all about C-spine injuries and log roll. Your spine runs from the top of your neck to your bottom. The very bottom of your spine is called the coccyx, and it's the part we damage when we slip on ice and land on our bum. It then runs up past our pelvis, lower back, upper back, where it meets our ribs, and then our neck. The part of the spine that runs through our neck is called the cervical spine, or C-spine. The C-spine is part of the spine that is more prone to damage in an accident, like a fall from height or a car crash. It can also get damaged if our head gets hit hard by an object or if we dive into shallow water. If you feel down the back of your neck, you will feel your spine. There are 7 vertebrae that make up the C-spine, and in the middle runs your spinal cord. If the spinal cord is damaged, it can cause problems with breathing and/or movement of the lower body and maybe even paralysis. If someone has been involved in an accident that could have damaged their C-spine, then we need to consider keeping them in line and neutral to prevent any further damage. If someone is lying on the floor and says that their neck is painful, then try and keep them still. Place a hand either side of their head and discourage either movement, and wait for the emergency services to arrive. Unfortunately, not all incidents are this simple. If someone has any other medical or trauma injuries, then this may take priority. It is worth knowing that out of all major trauma incidents where casualties have multiple injuries, then C-spine injuries are found in less than 0.5% of these cases. This means we need to prioritise any airway, breathing or circulation problems over these potential neck injuries. For example, you may need to stop a bleed, clear someone's airway by placing them on their side, or sit them up so they can breathe easier. These are way more important than a neck injury that they probably don't have. Signs and symptoms of a C-spine injury are pain or tenderness in the neck, numbness or pins and needles in the arms or legs, muscle spasms, loss of movement or sensation below the neck. First aiders should not remove helmets of motorcyclists unless CPR is needed, but make sure you monitor them carefully. First responders are trained to remove helmets and should do so to assess the patient properly. If you need to move a person who has a suspected C-spine injury, you can use a technique called a log roll. This technique helps keep the person's head, neck and back in line to prevent further damage. One person places a hand at either side of their head and 3 people kneel down the patient's side. They reach across the body and cross over hands. The person at the head always gives the commands, and they will say something like, "We are going to roll the person to my right on the word move. Ready, brace, move." The person can then be tilted to place a stretcher underneath or to help clear the airway if they are vomiting. This is a practical skill that needs practicing. To recap, if you suspect someone has a C-spine injury due to a trauma accident, then if possible, keep them still. If you need to move them to treat an ABC issue, then this takes priority as C-spine injuries are less common and therefore less life-threatening. Thank you for listening. I hope you found this helpful.